Ever wondered why doctors prescribe medication for high blood sugar without checking insulin levels? What if the real problem isn't just high blood sugar, but the hidden insulin resistance? In this mock conversation, a patient challenges their doctor on the flawed medical approach to diabetes and chronic disease. Should we rely on lifelong meds, or is there a better way to heal? This scripted dialogue is based on real science and the struggles many face when questioning mainstream medicine. Watch till the end and decide for yourself. Is your doctor keeping you sick?
Doctor, I just received my blood work results and it shows my blood sugar is slightly elevated. I see here that you've already prescribed medication. I've been following a low-carb lifestyle and honestly feel better than ever. Before we opt for medications, could we discuss other possible causes?
I understand your concern, but elevated blood sugar is a serious warning sign we shouldn't ignore. If we don't intervene now with proper medication, you could be facing severe complications down the road: nerve damage, kidney failure, even heart disease. The medication I prescribe helps keep your blood sugar in check.
I definitely understand the risks of uncontrolled blood sugar. What I'm wondering is why we're only focusing on lowering the blood sugar instead of treating what I believe is the root cause: insulin resistance. Chronically high insulin levels typically come long before blood sugar rises. If we don't fix that underlying issue, aren't we just masking symptoms?
Sam, please be aware, we focus on blood sugar because it's the key diagnostic marker for diabetes and prediabetes. Fasting insulin isn't part of standard testing protocols because controlling blood sugar is our immediate priority to prevent complications.
That is exactly my point. Blood sugar is just a symptom. You may already be aware of Dr. Joseph Kraft's research. He found that most people with insulin resistance had completely normal blood sugar for years before developing diabetes. By waiting until blood sugar is elevated, we are diagnosing the disease too late in the process.
Sure, I'm familiar with Kraft's work. Even if fasting insulin is potentially an earlier marker, there's no FDA-approved treatment specifically designed to lower insulin levels directly. That's why we rely on medications like metformin to manage blood sugar and reduce the risk of complications. It's the standard of care.
So, Dr. Joe, what happens when metformin stops working? Patients get prescribed stronger medications and then insulin injections eventually. And the side effects, digestive issues, muscle pain, weight gain, they're not minor for many people. Then those side effects lead to even more medications for those new problems. It's a never-ending cycle.
That's simply how we manage chronic diseases. Diabetes is progressive in nature, and medication helps slow its impact on your body over time.
I think that is the real problem. It seems that the system is not designed to cure, it's designed to manage. Patients start with one pill, then end up on a cocktail of drugs for life, never actually getting better. Pardon me, how is that healthcare? It feels more like disease maintenance.
Well, lifestyle changes are always encouraged alongside medication, but let's be realistic. Most patients don't stick to restrictive diets like keto in the long run. It's unrealistic to expect everyone to avoid carbs forever.
Unfortunately, Doc, that is a misconception I hear frequently. You would have also seen the Virta Health study. Type 2 diabetics who followed a ketogenic diet not only lowered their blood sugar, but actually reversed their diabetes without needing more medication. Many were able to discontinue their meds entirely. Why aren't doctors promoting this approach more aggressively?
Because long-term data on ketogenic diets is still somewhat limited. Plus, there are legitimate concerns about high saturated fat intake and potential nutrient deficiencies with such restrictive eating patterns.
Yet recent studies, including several in the American Journal of Clinical Nutrition, found no link between saturated fat and heart disease. Meanwhile, a study in diabetes therapy showed ketogenic diets improve triglycerides, HDL cholesterol, and other cardiovascular markers. The science supporting this approach is there, so why are we ignoring it?
Then you must appreciate, medicine follows established guidelines, and those guidelines are based on large-scale studies conducted over decades. We can't simply overhaul them based on a handful of newer studies, no matter how promising they might be.
With due respect, Dr. Joe, following potentially outdated guidelines means millions of people stay trapped in this cycle, more medication, more side effects, and no actual cure. All I'm asking is why not at least test my fasting insulin and consider diet first strategies before putting me on lifelong drugs?
I understand your frustration. Tell you what, I'll order a fasting insulin test. But I need you to understand that if your blood sugar remains elevated, we may still need to discuss medication options.
That's all I ask. Let's treat the cause, not just the symptoms. If my insulin is high, I want the chance to reverse it naturally before going down the path of endless prescriptions. I've been researching this extensively, and there are so many success stories of people who've actually overcome insulin resistance through targeted lifestyle changes.
Sam, I do appreciate your proactive approach to your health. Just keep in mind that while lifestyle modifications can be powerful, they're not always sufficient for everyone.
Absolutely. I'm not against medication when truly necessary. I just want to make sure we've explored all options first. By the way, have you had many patients try low carb or ketogenic approaches?
Yes, a few patients have attempted it. Some saw impressive results initially, but compliance tends to drop over time. That's my main concern with diet-based interventions: sustainability.
That makes sense. What I've found helpful is focusing on healthy, unprocessed whole foods that I enjoy, rather than thinking about what I'm giving up. It feels more sustainable that way. And the increased energy and mental clarity I've experienced make it easier to stay motivated.
Those are positive benefits, certainly. What does your current diet look like specifically?
I focus on protein sources like meat, eggs, fish, and poultry, and non-starchy vegetables. I consume healthy fats from avocados, olive oil, coconut oil, and ghee. I have totally eliminated processed, ultra-processed, hydrogenated seed or vegetable oils that are way too high on omega-6 fatty acids. I do eat berries occasionally, but definitely avoid grains, sugars, starches, and processed foods. I'm not hungry all the time like I used to be, which has been life-changing.
That sounds reasonably balanced. My concern would be ensuring adequate fiber and micronutrients. Sam, I'm impressed with your thoroughness. All right, let's get that insulin test and reassess in a few weeks. In the meantime, continue what you're doing but monitor for any unusual symptoms.
Perfect. Dr. Joe, I really appreciate your willingness to work with me on this. It means a lot to have a doctor who listens.
That's what I'm here for. Healthcare should be collaborative. I'll have my nurse call you with the lab orders today.
Thank you once again, Dr. Joe. I'm looking forward to seeing the results and figuring out our next steps together.